So we're going to have a conversation with Dr. Precious McCowan and Jack Lennon about incorporating the patient perspective and moderated by Dr. Ann Hummel. So Precious McCowan is a nationally recognized kidney disease advocate whose journey started in 2010 with a kidney and pancreas transplant, followed by 2 additional kidney transplants in 2019 and subsequently 2024 after prolonged periods on dialysis. Her lived experience has fueled over a decade of impactful work, advancing tailored kidney care, integrating mental health and chronic illness management, and improving patient health literacy. She has served on numerous advisory boards, including the NKF, UNOS, OPTN, ASN, Memo Therapeutics, and others, ensuring a patient voice is represented in research, policy, and practice. In addition to co-authoring several publications of collaborative work with institutions such as UNC and UCSF, continue to influence patient-centered innovation in nephrology. She's a passionate speaker mentor who's dedicated to empowering others and guided by the principle to be service to all mankind. Our other patient advocate for the conversation today is Jack Lennon, who's a lifelong kidney patient who's having been born with post-urethral valves. His first transplant was in 1995 at the age of 7 that lasted 15 years. Since then, he has had experience with both PD and in-center hemodialysis and 2 subsequent transplants. He just celebrated his 11th kidney anniversary, congratulations, with a perfectly matched kidney from his older brother this past month. As a result of his personal journey, Jack has dedicated his professional career to improving healthcare in the field of nephrology in his own way. He spent 8 years at Cincinnati Children's Hospital in the Division of Nephrology and Corporate Strategy, was the founding executive director of Improving Renal Outcomes Collaborative, which is IROC. It's a learning health collaborative of more than 40 kidney transplant programs. Spent time with CVS Kidney Care and has been at Vertex most recently, working on a number of kidney diseases. And finally, our moderator for this afternoon is Dr. Ann Hummel, who's a transplant nephrologist and clinical researcher within the Department of Kidney Medicine at the Cleveland Clinic. She's an assistant professor of medicine at Cleveland Clinic's Lerner College of Medicine. After graduating from Northeast Ohio Medical University, she completed a medicine residency at University Hospitals Cleveland Medical Center, where she also served as chief resident, went on to complete a general nephrology and transplant nephrology fellowship training. Her primary research focus is on health disparities in kidney disease, particularly in access to kidney transplantation. She has received federal funding from NIDDK to study barriers to care for patients with failing kidney transplants, and currently is a multi-PI for NIDDK-funded the Cleveland COPE AKI grant that seeks to improve care for patients discharged from the hospital following AKI. She's also the chairperson of the Medical Review Board for the ESRD network and co-chair of the Transplant Coalition working on QI projects for ESRD. So welcome, Dr. Hummel, Jack, and Precious to this conversation.
Thank you. Thanks so much, Sumit. I think it's critically important that we include patient partners as we advance kidney care in our nation. I think patients overall bring something through their lived experience as a unique vantage point to all of us, and can help eliminate our blind spots when we make policies and legislation and finance kidney care in the U.S. So we're truly honored to have both Jack and Precious here with us today. I'd like to keep this conversational. We did devise some questions that I think you had a chance to preview, and maybe we'll just go ahead and start from the top. If each of you could first let us know how you first became involved in advocacy by sharing your story to improve kidney health policy.
Precious, why don't you lead off?
All right, sounds good. So thank you. I first became involved in advocacy and sharing my story to improve kidney health policy after experiencing the many challenges that comes with living with kidney disease. So my journey began, as you all know, in 2010 with my first kidney and pancreas transplant, which unfortunately it failed within 7 months. I then spent the next 8 years on in-center hemodialysis, which exposed me to actually realize the experiences that patients face, on dialysis. So I experienced them having issues with lack of support. They had mental health struggles and gaps in communication and health literacy within the healthcare system. So these experiences inspired me to speak up, not just for myself, but for others who felt like they were unheard, my peers, those that I connect with. So I started by serving as a dialysis facility patient representative and later joined the ESRD Network 14 Patient Advisory Council. From there, I became deeply involved in national and regional efforts to ensure patients have a voice in shaping health policy. I've served on numerous boards, as you have heard, and in committees, including those with AAKP, the National Kidney Foundation, OPTN, Kidney Health Initiative, PFPC, and more. So advocating became a way for me to actually to turn my struggles into purpose. So I've shaped my perspectives on key issues such as fair access to transplantation, including my work on the OPTN EGFR committee to eliminate the race-based bias in kidney transplant wait list criteria. So every step of the way, my goal has been to advocate for equitable care, improve health literacy, policy, and more sustainable mental health support for kidney patients. So ultimately, I got involved because I knew change was needed. And I believe that my story and the story of others could help drive that change.
Thanks so much, Precious. Jack?
Yeah. So similar to Precious, my journey started early and started small and has sort of grown and has been influenced by multiple people. And I think one of the key things is the deep partnership with your healthcare provider in that growing your advocacy journey. So mine actually started way before I even realized it was happening. When I was at Cincinnati Children's, I had been transplanted, and we used to have a Christmas party or a holiday party with all of the providers and individuals that were being treated there. And me and my family would be asked by the nephrologist to go around to the different tables and talk about our experience, and just in sharing that experience with other families who were also considering that option. So way before I even knew what advocacy or policy was, my provider was sort of encouraging me to do that. Secondly, I'd like to give a big shout out to Ray Bicknell, who trained at Cincinnati Children's while I was there and sort of really got me, encouraged me to expand sort of the impact beyond the hospital system I was working in, more at the state and national level. So big thanks to Ray Bicknell, and those kind of opportunities have been FDA workshops back in the past, CMS TEPS Hill Days with the ASN, and currently with Precious sit on the PFPC through the KHI, which is the public-private partnership that ASN has with the FDA.
Great. Thanks so much, Jack. So it sounds like both of you have had quite a long kidney journey. What are some ways in which you think the current healthcare system does not work well for patients with kidney disease right now? Either one of you can start.
Oh, wow. So as a patient, I can tell you firsthand that the current healthcare system often, it feels like it's working against us sometimes rather than for us, especially if you're living with kidney disease. For example, and this is something I faced too while on dialysis, was infection, bloodstream infection. So for example, one of the biggest challenges we face is access to infection prevention tools that could literally save our lives. Right now, the CMS bundle payment system makes it hard for new innovation like infection fighting drugs or devices to actually reach patients like me. Even if a new technology could lower the risk of infection during dialysis, it's not guaranteed that patients would have access to it. Why? Because, decisions are often made based on cost, not on what's best for individual health. So this system puts my care in the hands of administrators instead of my kidney doctors. That's frustrating, and quite frankly, it's very frightening. So we deserve care that's based on our personal risk, not on a spreadsheet. So another way the system fails us is on the prevention side. So for over a decade, the kidney community has pushed for national screening for kidney disease, and it still hasn't happened. That's an issue. So without early screening, too many patients are being diagnosed with when it's already too late. That was an issue for me as well, being diagnosed when it was already too late. So that means that more people on dialysis, more transplants, and more suffering when there are already tools that could catch kidney disease early on. So that's an issue. So if we want to see real change, we need a system that values innovation, prevention, and most importantly, voices and needs of the patient.
Thank you. Thank you, Precious. Those points are really well made. Jack, maybe you can take the next question about what changes do you think would it be implemented into the system to help you navigate through the various stages of kidney disease, like you described as a young person to more your adulthood?
Yeah, so I'm actually going to build on Precious's point and think about the care coordination that we as patients sort of have to take on. Kidney disease, I don't think I've met another patient or patient advocate that has kidney disease and no other comorbidities. And so we're seeing multiple specialists. We've potentially got primary care. And by the way, who came up with the word comorbidity? Can we change that to something else, something a little bit more friendly? Anyway, but it's also, I think, through the kidney journey, right? It is CKD, dialysis, and transplant. It's almost like looking out a window, especially as nephrologists and your care team changes. It's almost like when you're in transplant, you have your transplant team. When you're in dialysis, you have your dialysis team, and there's nobody looking out the full window to see your entire journey other than the patient. And so I think, the practical changes, there's somebody that can help the individual be the one point of contact between, diagnosis sort of all the way through the journey to who has potentially been there before, or has, so some of that expertise, in each of the small changes that have to change from the clinical care, from, not drinking a lot of water on dialysis to drinking lots of water. So some of the clinical things versus some of the actual policy and insurance changes that might occur, and sort of helping us navigate that whole spectrum, because I don't think it can fall on the care team.
Mm-hmm. Thanks, Jack. Maybe a question to dovetail on that would be that people often talk about the patient perspective as if all patients are very similar and there's a unified perspective, but we know that that might not always be the case. Can you think of some policy issues in which you found that there's a wide range of opinion among patients who you've interacted with or they've talked to you about, either Precious or Jack, if things come to mind about that?
So yeah, I could take that. And so through my advocacy work, I've seen the patient have a wide range of opinions on key kidney health policies. And, that's important to recognize. For example, you can look at dialysis modalities. That's a big one. Some patients feel safe in center, while others, they want flexibility of home dialysis. But many were never told about their options and that they had options or that they may qualify for different options. So that's a policy gap in informed choice and access. Also looking at transplant eligibility. That's another one. That's another area with mixed views. Some see strict criteria as necessary, while others feel that it's unfair or it lacks transparency, especially with issues like the former EGFR Black race adjustment. So those are, just a few to answer your question. I don't know if Jack would want to elaborate or add to that.
Sure, absolutely. Thanks, Precious.
Yeah, Precious, I totally agree. And I think it's, I think where we get into trouble is when we try to create policies that go a directive way for both providers and patients. And I think it's really, about patient choice with their providers and not limiting, options moving forward. I think that's typically where we get into the most trouble. And Precious already gave some great more specific examples of that.
Great, thanks. So what do you think policymakers and nephrology, kidney medicine organizations can understand better about patients living with kidney disease? I think you've talked a little bit about like getting information and making personalized choices. Are there other things that come to mind that policymakers can understand more about patients with kidney disease?
I'll jump in here, Precious, and then again, feel free to add. So I think it's, a lot of times we think about the kidney specific policies, but living with kidney disease impacts lots of other parts of our lives. It, impacts education. It can impact housing. It can impact, our families. And so, I think one of the biggest things to sort of realize is, it's, yes, the kidney specific things and broader health related, but to actually expand into some of the more sort of population health and sort of general infrastructure that supports individuals, I think, and particularly, with our sort of historically marginalized communities and the disparities to care, making sure that we're addressing those through policy as well, I think sort of, it amplifies that particular point.
Yeah, that's all really important, Jack. Thank you.
Jack said it all. He said it all. So I really have nothing to add to that. Thank
Great.
you, Jack.
Thanks. So in your minds, what does meaningful patient engagement look like in the policy setting? What would make it easier for patients to participate and have a stronger voice?
So for me, going back to being a patient advocate and a mentor, meaningful patient engagement in a policy setting means more than just having a seat at the table. It means having a voice that is heard, respected, and acted on. It's not just inviting patients to speak after decisions are nearly finalized. It's involving us from the beginning throughout the process and following up on how our input is, pretty much being used. So, and I would just want you all to remember that, we may not have all the medical expertise, but we bring lived experiences that can't be captured in charts and clinical metrics. So when we're engaged meaningfully, policies become more practical, equitable, and person-centered. So just remember that.
Thanks, Precious.
And I think to that, I think I would add one is it's not just the patients and is that it is our caregivers as well that need to be sort of engaged in sort of that policy setting. And I think we traditionally, typically as patients, I think sometimes think of sort of the policy piece of going to Capitol Hill and engaging directly with sort of policymakers. I think it also can happen with our sort of patient advocacy organizations, our professional societies, and engaging us at the beginning a little bit, Precious, to your point, in sort of this is what we are thinking about, and getting that, because not all of us are comfortable sharing our stories in those bigger sort of potentially daunting experiences on Capitol Hill, and getting us one-on-one in a room, saying this is what we're trying to do, even maybe showing us the language that is going into a particular policy or bill, et cetera, to get that sort of one-on-one feedback. And I think that's another really meaningful way. It's not always just in these big events, but in the sort of day-to-day, and keeping us updated, as Precious talked about, like, we provided input, how's it going, et cetera. Yeah.
And can I add very quickly? So I just want you to also know that true engagement, so it is a partnership. So when patients are empowered and supported to contribute policy becomes not only more inclusive, but more effective. So I think that's a key point as well.
Yeah,
absolutely.
Sorry, Dr. Huml, we keep
That's okay.
on. I think the other really point there, Precious, is, and again, from my personal experience, the partnership with your care provider too, to get into and that meaningful engagement, I think is really important. Again, from my personal experience, it was my nephrologist I knew who encouraged me to go, and actually seeing that partnership of why it matters to the provider and why it matters to the patient is typically, really where the message amplifies that we're speaking the same language and we're really wanting the same thing. And just to clarify my caregiver comment about them being involved, I actually called my mom before as I was prepping for this call, because she was the primary caregiver for much of my young life managing with the disease, and I still go to her with some of these types of questions. And so and she's never really been involved, and so it's probably something on me to say, Mom, you should come do these types of things. You've got such good insights. So I'm doing my best to try to represent, but she would also be good at these types of things, I'm realizing.
Yeah, I like that, Jack, bringing the caregiver to the table as well. So you've talked about the sort of longitudinal involvement in advocacy and policy, and this also like scale, large, big forums, and then smaller advocacy things. This is a little bit off the script, but do either of you have anything that comes to mind as like, what is your most memorable moment in advocating for kidney care or kidney patients?
Yes, and this was for the transplant community. And I briefly touched on it. Being a part of the EGFR, I was part of the kidney committee with OPTN, and they had a subcommittee that actually worked on, it was an EGFR working group. And so we worked together to see what this policy should look like. Mind you, I was the only patient representative. So I went in, although this issue never affected me through my kidney journey, I went in as if it did. I advocated hard for what the language should say, how it should be done. It was a fight, but we came to common ground, and we see that all of it has rolled out. And I was really proud and happy to know that so many of my peers contacted me and said they gained wait time, like they were bumped up the kidney transplant wait list because of this removal.
Yeah, that's wonderful, Precious, the impact of what you contributed to other people's journey for sure. Jack, does any like one incident come to mind?
Yeah, and yes, there are a couple, but I think one that I think illustrates Precious's point was we were advocating for the Living Donor Protection Act. This was one of the very first times I went with ASN to Capitol Hill. I went and met with my particular congressman. We found out that his sister was a bone marrow transplant recipient as well, and so he made that connection. Actually, what happened afterwards was his office specifically emailed the couple of us that went to his office and said he is signing on as a co-sponsor. And so I think just that follow-up of, what happens, as a result of being active like this is really, I think, the special piece that we sort of all, hunger for.
Yeah, absolutely. The impact seems most meaningful. So, what advice would you give to other patients who want to get involved with either policy or advocacy work? Maybe where do you think you went wrong or could have done better, or how do you involve other people and bring them along with us?
So what I've learned, as an advocate and mentor, I would tell them, hey, start with your story, because your experience matters. You don't need to be a policy expert to make an impact. What you've lived through as a patient, it offers insight that can help shape real change. So share your story, your journey, your challenges, and what you wish had been different. That's how systems begin to shift. I'll also tell them to get connected. Look for opportunities with organizations like AAKP, the National Kidney Foundation, AKF, or your local ESRD network. Many of them have patient councils, mentorship programs, and advisory committees where you can be involved and build confidence. Also, I would tell them, don't be afraid, speak up, Also, ask for support. It's okay to need guidance and seek mentors. Ask questions and take advantage of trainings that help you understand the policy space. So that's what I would tell them.
Thanks, Precious. Jack, any advice for others?
Yeah, I think, the patient advocacy organizations have a wealth of information, many of which have already been mentioned earlier. I think the other thing that I would say is, again, asking your provider. Your providers are typically interested in this too, and can, you typically have a multidisciplinary team that if they don't know, they can go ask, and it sort of elevates and escalates from there. And sort of asking those questions, as Precious mentioned earlier, I think the one thing, Dr. Huml, this wasn't exactly your question, but like, what would we do different, or how would I, like, as I look around at my other patient advocates, we've been through dialysis, most of us have been through transplant, and so getting more early stage sort of chronic kidney disease individuals, we can't remember, all of us, everything that we wanted at the time when we were diagnosed, at the time we were managing through different crises or the chronic nature of the disease. And so I guess my call is more of like, help get more early diagnosed CKD patients involved in the policy and advocacy area, because I think it'll just tremendously enrich the insights and what we can, sort of do.
Thanks so much. Well, I want to open it up if there's anything else you want to share that we didn't specifically ask today, and certainly thank you very much for your participation in this panel during our lunch break, but we really appreciate your valuable insights.
So one thing I just want to say quickly about, to individuals that want to get out there and advocate, please remember that advocacy takes time, and change, it doesn't happen overnight. But remember that every meeting you attend, every story you tell, every suggestion you offer, it moves the needle forward. So you're not just representing yourself, you're opening doors for others too as well. So I wanted to add that. Your voice
Precious, I couldn't have ended it better myself. Jack, anything else you want to include?
No, Precious said it. Perfect.
Great. Well, thank you so much for both of your valuable insights. Thank you.
Yeah, I just want to thank all three of you. That was really a fantastic talk. I think it had a ton of discussion, a lot of insight, and hopefully reach the ears it is intended to reach.